Folks, please, unless it's for an essential reason, please stay home. Because the situation is extremely serious and we just need to hunker down right now. We need to limit mobility.
Ontarians will once again be under a stay-at-home order starting at midnight. All non-essential businesses will be limited to curbside pickup or delivery, and big box stores will be restricted to selling only essential items. Sylvia Jones is the Solicitor General of Ontario. She joins us now from Orangeville. Hi, Solicitor General. Good to have you with us tonight. Thank you for making the time.
Thank you for asking me.
More than a week ago, on March 29th, the head of the science table that advises your government said the pandemic was out of control. Why did it take your government more than a week to do what you did today?
Well, I think, frankly, it was the ICU numbers. You know, intensive care unit beds have gone up actually faster than what the modeling table and the science modelers were sharing with us. And when we saw that, as the Premier mentioned in his press conference today, he started immediately and asked for the drafting of the emergency order and the declaration of emergency stay-at-home orders.
I did hear the Premier say that he heard those numbers and saw those numbers first tomorrow. But I recall, you know, for example, the Ontario Medical Association warning of the increases in ICUs back on March 30th. On April 1st, 150 ICU doctors in the province wrote the Premier. They flagged the capacity issues. They said, quote, "We believe new public health measures are required immediately in order to regain control of the pandemic and save lives." Is your government being disingenuous when you say you just learned of increases in the ICU?
No, I don't believe that, Vashti, because we did institute an emergency break last week, as you know, before the Easter long weekend. We put some measures in. We are very responsive and reacting very quickly when local public health units ask for a more strong, stringent shutdown. The ICU beds really were the tipping point that said, even as we continue to vaccinate over 100,000 people every day, we need to have this opportunity of 28 days to get vaccinations in people's arms and make sure that we keep people safe.
Respectfully, though, that didn't address the substance of my question, which was that these ICU increases are not new. They were made evident over the past week through direct letters to the Premier, in fact. What evidence do you have to the contrary?
Well, the modeling table and the science that we were looking at last week actually didn't have our ICU rates at the numbers that we have seen today, which of course is over 500. That really was the driving factor. We have continued to ramp up vaccination opportunities, but we need the opportunity to give, frankly, our very, very hardworking and overworked healthcare workers who are working in those ICU and hospital facilities a break so that we can catch up and try to drive down the ICU numbers.
Beyond just the discrepancy over ICU numbers, though, I remember back in February when the science table was again saying, this is not the time to take your foot off the brake. This is not the time to loosen restrictions. We are heading for a, quote, potential disaster come early March if the government doesn't keep this stay-at-home order in place. Their modeling at the time was showing that. Does your government regret the decision to take its foot off the brake, to loosen some of those restrictions at the time?
Well, I think what you saw was, in fact, March, we were not being overwhelmed in our hospitals and our ICUs. So we need to give people a bit of a balance, a bit of hope so that they can start to resume some of their activities. We did that in March when we started to see both the ramp up of vaccines coming through the federal government, as well as constantly communicating with our public health units to say, how are your hospitals doing? How are your positivity rates? And the framework allowed us to do that very quickly. We saw that with both Thunder Bay and Sudbury asking proactively to be moved. And within 24 hours, we were moving them into a gray zone so that they could get the additional time they needed to try to limit those positivity rates and numbers.
With respect, though, if the decision to give people a bit of a break back in February had been the right one, would we not be in this situation right now?
I don't think you can make that comparison, frankly. I think what we are seeing right now is variants of concern that, frankly, are spreading much faster than the original COVID-19. And what we are doing is acknowledging that those variants of concern, the UK variant, the Brazilian variant, et cetera, really do spread through our community much easier and, frankly, are making people sicker.
With respect, though, you waited until that happened, though back in February, the modeling was showing it would.
I can't agree, Vassie, frankly. What we are doing is reacting and responding very quickly when we see it. We do want people to have some hope that their measures are happening or making a difference. But as I said, the variants of concern are able to transmit easier. And we are now seeing, even though we have been able to successfully vaccinate the vast number of over 80 and over 70 and working very quickly through the over 60s, that it is becoming a more serious illness when we see it in our younger people. And that's what this emergency break, that's what this declaration is giving us, that 28 days to be able to get more people vaccinated and protected.
And I certainly take your point. I guess what I'm trying to get at is, though, in February, that's what we were being told, right? That's what the science table was telling the government. These are more dangerous. They are more transmissible. They will affect younger populations. It's not like your government just found this out now. Are you sympathetic to the idea that, to the criticism, really, that you waited too long?
But we were also not seeing the intensive care unit bed take up in February and March. That monitoring, that control to make sure that we were balancing what our hospital capacity could take, as well as the human toll. I'm thinking of those 500 individuals who are currently in ICU beds. They have loved ones, they have friends and neighbors who want to get better. I don't want to be in a situation where the next person who needs an intensive care unit bed, whether it comes from a car accident or a COVID treatment, doesn't have access. And that's why we've had to declare this third declaration of emergency. And that's why we're doing the 28-day stay-at-home order.
With respect, again, though, there were 400 people in the ICU last week. Wasn't that concerning then?
The balance of the capacity that we have, both in terms of actual beds and the health human resources needed to protect those individuals, is what we were constantly looking at. And as I said, when we start to see numbers that are actually higher than what the modeling was suggesting we would be seeing, that's when we had to act quickly, and we did that today.
Okay, Solicitor General, I'm out of time. I have to leave it there. I do appreciate your time. Thank you very much.
Stay safe.
That's Ontario Solicitor General Sylvia Jones. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.